Hello, I'm Jacqueline Moore. I'm a board-certified general surgeon and fellow of the American College of Surgeons. I practice with Sentara Surgery Specialists here in the Woodbridge and Stafford offices. The LINX procedure is a surgical treatment of gastroesophageal reflux disease. Unlike the alternative, the Nissen fundoplication, it is a flexible ring of magnets that is designed to be placed around the lower end of the esophagus at the junction between the esophagus and the gastric body. It creates a high pressure zone, which prevents the reflux of gastric contents back into the esophagus. How it differs from Nissen fundoplication is that it does not use the native anatomy of the stomach, so there is no surgical dissection of that part of the stomach. It is more durable, being that it is synthetic, made of earth metals. It is going to last longer than your patient. And it's also been shown to be very effective since its approval by the FDA in 2012, with minimal side effects and with minimal complications. The gold standard is still the Nissen fundoplication. It's the surgery by which any other surgical management for gastroesophageal reflux disease is going to be measured. That being said, LINX has been shown over the past decade to be extremely effective. The LINX is reproducible, so you're going to get consistent results every time. It's durable. It's been shown to be very effective over 10 years, and when they survey these patients who've had this surgery, 99% of them still have excellent control of their reflux symptoms. Number three, it's associated with a low rate of side effects. The LINX procedure is typically a same-day surgery procedure. It can require an overnight stay in some patients. We generally tell patients to start eating the same day after LINX because the goal is to eat a regular diet as soon as possible. As far as pain management, it's typical for laparoscopic surgery. We send them home with a few days worth of narcotic pain medications to help with that post-surgical pain. Within about 3 or 4 days, they're feeling fairly comfortable and are able to manage their post-op discomfort on Tylenol and ibuprofen. And most patients can go back to work within a week after surgery. The patients that you might consider for surgical treatment of gastroesophageal reflux disease are those patients that may not have symptoms completely controlled on medical therapy. There are those patients who are on medical therapy but are concerned about the potential side effects of long-term use of PPIs that has been of recent interest in the media. There are those patients who suffer from regurgitation, that is the reflux of gastric contents, undigested food into the esophagus. That can be very distressing, and that is not solved by medical management. Also, there are those patients that just may not want to be on medications for the rest of their lives. LINX is not going to be the device for every single patient with reflux disease. But for those patients who do have the LINX implanted, their outcomes are spectacular. More than 85% of patients are going to be very satisfied with the LINX. It's going to manage their chief complaint, which is heartburn or regurgitation. And it's going to do it without many side effects. That being said, they get back to their normal lives very, very quickly.